met patients over the years, and they've had a hair transplant, and they're looking at themselves and saying, yeah, it's grown okay, but I can't quite put my finger on why it looks odd. And I think a lot of that is to do with the hairline being brought down too low. Not necessarily that it looks unnatural or pluggy, but loads of clinics, they just don't do anything with the temporal points. They have this sort of low, wide forehead, and when you look in the mirror, you think, actually, it looks okay, but from your left and right profile, it just doesn't look right. It looks too heavy and too low. And I know that you're really keen on temporal point restoration, so just talk us through a little bit regarding that.
A big fan of the temporal point in the right context.
Yeah.
And I do a lot of video calls, especially since COVID, and these days people travel from far and wide. So it's sometimes on the call I will ask people to sort of map out with their finger where they'd envisage their hairline going in an ideal world. And it's really interesting because the finger starts off confidently in the midline, but then they get towards the temples and they're like, oh, I'm not really quite sure how to finish this, I'm just going to do that. Yeah. or they just stop it and you don't know what to do with this bit. And the piece of the jigsaw puzzle they're missing is the temporal point.
Yeah.
And in nature, you never recede at the temporal points without receding here. Sometimes you can recede in your temples and you can recede in your parietal hairline. It's kind of in proportion, and that sort of looks okay. But if you're restoring that bit without restoring that bit, then it can look very out of proportion. Yeah. And like you say, it's the sort of thing you're walking down the high street and you look at someone and you think, oh, there's not something quite right about this guy. Yeah. And that's often it.